About 500,000 Americans get kidney stones every year, and they're even more common for us here in this part of the country. Dr. Hanna Pham, a urologist with Houston Metro Urology, is joining me live now to talk more about it. First, tell people if they're fortunate enough not to know, what are kidney stones?
Yeah, so kidney stones are hard deposits of minerals that can form inside the kidneys. They can come in all sorts of shapes and sizes, and they could never give you any issues, or they can cause severe problems such as severe pain, can cause infection, and can also sometimes lead to kidney dysfunction.
But I didn't know that there were some people who didn't have symptoms. I thought that was always like excruciatingly painful.
Yeah, so some kidney stones are so small, like a little granule of sand that just hangs on the kidney, and you never know.
And they can be big too.
They can be very big.
I was telling you about a report that I did a while ago where the urologist showed me a stone, and it was huge. But you say that there's a range of treatments, so that one probably had to be surgically removed, but there's other types of things that you can do to remove them as well.
Right. So when they're really small, we usually recommend observation, and we can talk about kidney stone prevention diet as well, and that prevents the stone from getting bigger. But when the stone is small and you don't change your diet, you don't stay hydrated, they can get very, very, very big, and into the point where it starts, affecting kidney function, and you may need a massive surgery to get them removed.
So let's talk about diet, because diet can be the reason that they form, and it can also be some things that you can change to obviously treat them. So what are some of the things that we're eating that could increase your risk of kidney stones?
Yeah, so you know how you mentioned the stone belt, right? So that's like all the southern states in the U.S., and we notice that there's a higher prevalence of stone formation, and that's really because it's hotter here. I mean, it's October, it's still 90 degrees outside. We're sweating, we're not making as much urine, and this allows, the minerals in the kidney to deposit. And so hydration is the biggest thing that you can do to prevent kidney stones.
And that's why we get them more often, because we tend to be more dehydrated in these hotter regions.
100%. And then also diet. In the South, we love our salty foods, right? We love animal protein. And so those are things that increase the risk of stone formation.
Okay. Aren't there some like healthy foods on there too, like spinach, chocolate? Do those things also contribute?
Those are actually high in oxalate, and we recommend that patients limit their intake of high oxalate foods, and that's spinach, nuts, berries, chocolates, like all the greatest things in life. But I don't ever tell patients to cut those out of their diet completely, because I think that's really tough to do.
And they're health foods, we think of those as health foods.
But everything in moderation.
Okay, good point, good point. And then if you do have kidney stones, what should you be eating in your diet to maybe decrease them?
Yeah, so first off, water. A lot of water, drinking a lot of water. We recommend 2.5 liters of fluid intake per day. But for patients that don't like the taste of water, we recommend, lemon, lime, orange juice. Those fruits contain citrate, which inhibits stone formation. And also lemonade and orange juice are great alternatives as well.
Okay, so all like citrusy type drinks and foods and stuff like that?
Yes, absolutely.
Awesome. Any other, what are some of the ways that, any other ways that you can prevent kidney stones? Other than just a healthy diet, is there anything else that you can be doing?
So honestly, diet is like the main factor for kidney stone formation.
Okay.
There are patients that have genetic issues, or they're on certain medications, or they have medical conditions that predispose them to kidney stone formations. But those patients typically come and see a urologist, and we can help.
I'm sure you've seen that there's studies also showing that like riding roller coasters and stuff decrease your risk, but probably not something that everybody can do.
No,
If somebody does have kidney stones, what are the different treatment options that they have?
Yeah, so it typically depends on the size and the location of the stone. So if a patient has a small kidney stone and they're passing it, we typically recommend a trial of passage, and we can give them medications to kind of help them, pass the stone on their own without having to go to surgery. But if a person has a kidney stone that's stuck in place, it's not moving, it's causing them severe pain, they have nausea, vomiting, or they develop fevers, and that's an emergency, and they have to go, or I really, really recommend that they seek medical care. But in the cases where it's just nausea, vomiting, and just severe pain, then we can, either treat the stone by breaking it up with shockwave lithotripsy, or we can go up and laser the stone and break it up.
All right, Dr. Hanna Pham, thank you so much for that
Absolutely.
information. Anything else you'd like to add before I let you go?
That's all I have to add.
All
Just
right.
drink a lot of water.
Good point. Thank you so much.